People often ask me what inspired me to be a physical therapist. I look back, there wasn't one thing that inspired me, but I can't imagine having done anything else with my career or my life. I think it was just the right thing for me, and it has given me back as much as I've given it. I went to Russell Sage for my physical therapy degree, undergraduate. And at the time, Russell Sage's physical therapy program was associated with Albany Medical College. So I actually have a diploma from Russell Sage College and a diploma from Albany Medical College, as it was a shared program. And it was great because I got to train alongside of medical students. And I would say that that program had a very, very strong medical component. And I've always been very grateful for that. I did some graduate work at Russell Sage, and then I went on and earned my doctorate in physical therapy from Rosalind Franklin University in North Chicago, Illinois, which was a fabulous program and one of the better educational experiences of my career. And I love education, so that's saying something. When I graduated from physical therapy school, the recommendation was you went to work in a hospital because that's where you'd get the broadest experience. Healthcare then is very different than healthcare now. When I did my clinical affiliations my last year of physical therapy school, we had a lottery system to pick where you would go for your affiliation. So you had to fill out your first, second, and third choice. So I was in Troy and Albany for my education, so I picked hospitals in the Albany area, and I lived about 30 miles south, so I thought that'd be convenient. For my third choice, I think I was being humorous, and I saw a place in New Hampshire that offered board. There was housing that went along with the affiliation, and I jokingly checked it off and said to my friends, I'm gonna go to New Hampshire on vacation. And of course, I was the only person that picked that place, and affiliation sites were at a premium. So when they saw that I had checked that off, that is fast line for where I went for my affiliation. But it turned out to be fortuitous because I loved it there, and I ended up taking my first job out of college in New Hampshire. I lived at the base of a mountain on a lake. It was phenomenal. It was a great hospital. It was a great experience. And an opportunity presented for me to move back home. So from there, I went to a local hospital, and then I moved up to a larger hospital, still staying within that concept of working in a hospital system, but becoming more and more interested in orthopedics and outpatient. I eventually started my own practice in Catskill, New York for about 20 years. I controlled what was purchased, I controlled where the resources went, and how the care was provided. So when I hired people in my practice, I really wanted to help them be the best that they could be. Living in a rural community, it is difficult to get staff. And my practice, I was very fortunate, grew, and it's difficult to get staff. So when two of my therapists went out on maternity leave at the same time, and I received an offer to take a job that involves some management in skilled nursing facilities and rehab, I took that as an opportunity. So I put my practice on hiatus and went into skilled nursing long-term care and gained a lot of my practical knowledge there, being an administrator and supervising people and how to work within a system. While I was working in skilled nursing, I had the opportunity to take on a role that honestly became one of my favorite roles in my career. And that was as part of a team. It was two nurses and myself, and we traveled to different facilities. And when I look back at that position, I think I was like a paid mentor. And I was able to just help people be better at their job. And I was able to help patients get better care. And I was fortunate to work for an organization that cared about that. I controlled, that also led me to do a stint in academics. I was actually an adjunct instructor at Russell Sage College, my alma mater, where I taught several different courses, was a lab instructor, and worked within the academic world to really, again, mentor and educate people that were getting into the profession. The profession, from the moment I entered it, and it became very important to me that as a whole, physical therapy was given the respect that it deserved, and that patients were given access to physical therapy services, because the model had changed so much even since I graduated. It was expanding, our education requirements were expanding, and we really were able to move beyond just a prescriptive type service. At Russell Sage, I worked with students, I supported them, educated them, and mentored them as they entered the profession. About the same time, I wanted to give back to the profession, so I became an active member of the American Physical Therapy Association. I had been a member, and I have been a member since my junior year in college, but I had been a sometimes meeting attending member and maybe not so active, but I decided to take an active role, which probably professionally was the second most impactful decision that I made. I met the best of the best. I worked with the best of the best on committees and representing and lobbying for our profession, and more than just our profession, our patients. I became a member of the New York chapter in my particular district. I became a director. I became a delegate to our state delegation. I became a delegate to our national delegation. I served as the secretary of the New York State Physical Therapy Association, and I served as the vice president of the New York State Physical Therapy Association. I've always tried to look at the next opportunity, or how I could better myself, or how I could contribute more to patient care in general. So when I had my outpatient practice and somebody would come to me and they would say, I'm having trouble figuring out how to do this, or I'm struggling with this or that, those problems usually occurred at home. And here they're coming to my office and I'm trying to replicate those problems. So I would say, well, if you don't mind, can I just come to your house and see and help you there? Because to me, that was the practical solution. So when the administrative part of running a practice was starting to really wear me down, I thought about home care. I had been on the professional advisory committee of the Eddie Visiting Nurse Association for many years. And I sat on these quarterly committee meetings where they were always lamenting their shortage of physical therapists. So one day I just thought, so I went to work in 2011 for the Eddie Visiting Nurse Association, because again, people deal with their problems in their home. Sitting in a doctor's office or a therapist's office or in a hospital, you can't see what they have to deal with on a day-to-day basis. And to me, that was the challenge of home care, and that was the practicality of home care. It's also a huge privilege to be allowed into someone's home, to be able to see where they live, see what's important to them, see who they interact with and they deal with. So I was in the field working in home care and loving it, but always wanting to learn at the same time. An opportunity presented itself to be trained in this integrated home-based model of chronic care management. We had the chronic disease management coordinator would come to our care meetings and talk about the program at the Eddie and how important it was, and she would help us problem solve with patients. And I would always, I'm pretty outspoken, and I'm also pretty involved, so I don't sit quietly at too many meetings or too many events. So I started engaging in that program, And then I went to the training and got trained in this model and certified in this model. And then when that person left her position, I applied for it. That allowed me to be 50% in the field and 50% as leading the chronic disease management program at the Eddy. Another incredibly valuable, important part of my career, which I still use every day in my role now as primarily an administrator. Through that, I became involved in more and more of the administrative and quality care endeavors at the Eddy Visiting Nurse. People will say to me, "How did you know that?" Or "How did you figure that out?" Well, if you've been around long enough, you've encountered almost every problem there is. And the more problems you encounter and you get out of them, my goal is to share those solutions with other people and to help other people experience what I've experienced, or to prevent them from having to experience what I've experienced. Fast track right to the solution if you know somebody that's already been down that path. So I loved working at the Eddy. I worked with many clinicians, not just therapists. I work with all clinicians, and I have great relationships with many of them today. And I can say I'm really proud that occasionally, even though we've been separated for several years since I left, people still call me and ask me questions. And that's really rewarding to me, because I feel like that means they respect. They respect me and they respect what I've been able to contribute. While I thought the Eddy would be my swan song, would be where I ended my career, this amazing other opportunity presented. And that is with Everhome Care Advisors and Viva Links right now, where, again, taking all the knowledge that I've acquired in acute care, home care, education, skilled nursing facilities, community-based care, outpatient care, navigating insurance systems, watching them change, learning the new systems, taking all of that information and helping people navigate our very dysfunctional system. But it becomes less dysfunctional if you understand how it works. It seems dysfunctional when you don't know how to get from point A to point B, but if you have somebody that can help you get from point A to point B, then your outcomes are going to be better. So it may sound like a big stretch, but I think providing health advocacy and care coordination, which is what I'm doing now, I think that can help people have better health outcomes. And doesn't that help us all?